Hey everybody, this is Dr. Stephen Windley of IntegrateMedicine101.com, and I'm going to give you the short and sweet today on vitamin K2, which is it's got two big jobs for the heart and the bones, so it's pretty easy to cover, but it's very important. Vitamin K2, it's also listed on vitamins or in things you may read on the internet as MK7, or also called menaquinone 7. It's a highly absorbable form of K. And compared to the other form, which is vitamin K1, is a little newer. Vitamin K1's been around a long time. We know that it's in leafy green vegetables. It's one that has to be watched if you're taking a blood thinner, and so that's something that's been studied for a while. Vitamin K2 has also been known for a little bit, but not nearly as long as K1. The sources of vitamin K2 include a product called natto, which is a fermented soybean dish typically eaten in the Far East, in Japan. Eggs, organ meats will have some, and then a little bit in chicken. There is some in some cheeses, Munster and Gouda. And sauerkraut has just a little bit. As you can see, most of the sources are going to be dairy and meat products, with the exception of the soybean dish, which is really not eaten in the States. And from what I've heard, it's an acquired taste. It's not necessarily bad, I guess, but it's just a cultural difference that we aren't exposed to here. Vitamin K2, as far as what it does, it's got big jobs, and it's very important for the heart and for the bones, and it helps to manage calcium. It's part of that system, and it's telling calcium where to go, which is go to the bones and perhaps even the teeth where it is needed, and do not go to the heart vessels where we really don't want calcium. We're trying to help prevent the damage that can occur to lead to blockages in the blood vessels, and vitamin K seems to be vitamin K2 rather seems to be a part of that. And in place of that, it's saying to send the calcium to the bones. And so for that reason, it is good for bones, and we use it a lot in our osteoporosis programs at the clinic. But we also use it a lot for people who have heart disease or at high risk for heart disease. In general, it's tolerated very well. You want to take vitamin K with food or meal to help absorption, as it is a fat-soluble vitamin. If you do take a blood thinner called Coumadin or warfarin, you've got to check with your doctor on that. So it is one that there is a potential restriction there. The dosing in terms of what we use in the clinic varies quite a bit. It comes typically in doses of 45 micrograms, 45, 90, 180, 320 also. And so how high you go just depends on need. We'll obviously go higher doses for people with significant heart disease, and more moderate for just maintenance or prevention. But pretty simple take on it, pretty easy to cover, but a very, very important vitamin for what it does. Thanks a bunch for listening, and we'll talk to you soon on the next video.